Hello, friends. Welcome back. Today we are going to talk about liver cirrhosis. Cirrhosis can be of two types: alcoholic and non-alcoholic. As names suggest, prolonged alcohol abuse may cause cirrhosis. In the later part, I shall probably explain or give a small tip on how to manage or how to be safe on liver while having alcohol, right? Wait till the end of the video, right? So the other cirrhosis is a hereditary disease, autoimmune disorder. It is called PBC, primary biliary cirrhosis. If you are a lady and if your mother, grandmother, or sister has it, then probably you are a little more prone to that, because this usually inherit from ladies to ladies, though it is not always, right? So if you are a lady and at a higher risk of this PBC, from your teenage itself, you can start controlling your food and drugs which hurt the liver, right? So, as you all know, liver cirrhosis takes, years and decades, probably 10, 15, 20 years to progress to liver cirrhosis. So, if you start, controlling this food and drugs and, maintain the toxicity on the liver, you can prolong the progression in very, very long time. Okay. So what you need to do in that case, you need to reduce your intake of heavy protein rich food, meat, oily fried items and all. Of course, you need to control the intake of too much of carbohydrate, such as rice or sugar and all, right? And always have a check on your triglyceride level in the blood, and make sure you control it if it is there in deviation. Okay. And triglyceride can lead to fatty liver, and thereafter the fibrosis and liver cirrhosis. So control the triglyceride for sure. All right, so that's about that. There are some medicines like Usodils are available to slow down the damage, but you consult gastroenterologist before that. All right, now let's understand the symptoms of cirrhosis. The first and foremost symptom which we will be able to see in the cirrhosis is a swelling on your leg and feet. It's called edema. Then you can probably have swelling on your tummy. It is called ascites. Okay, it is essentially because of this fluid retention in your body, and due to gravity that will settle on your leg or your tummy. Okay, and that is, as the most common mild symptoms. Okay, so I'll just talk about how the liver functions. Basically, what is the primary function of liver? All right. All the food we eat is absorbed by a vein called portal vein, which will take it to the liver, and essentially it will filter in the liver. The liver is essentially a filter, and when it is damaged and blocked, the blood can't pass through this liver or the filter, and that will lead to the pressure backup on the portal vein. This portal hypertension, coupled with lack of enough albumin in the blood, can cause the blood vessels to leak fluid to the interstitial spaces, which will eventually accumulate on the tummy or legs. Okay, this is essentially what happens in the initial phases of liver cirrhosis. Now let's see the three most complex or dangerous conditions of cirrhosis. The first one is, of course, it is due to portal hypertension. The small blood vessels around the esophagus, stomach, intestine, all will be under tremendous pressure. Because of this, sometimes it can rupture, and if ruptures, the patient, after eating food, the patient can omit blood. This is because the blood vessel around your esophagus, the food pipe or stomach and intestine or anything can get ruptured and omit blood. This is a very, very critical condition, warrants immediate hospitalization. Right? Now, the second thing is when you eat very high proteins. it will not get properly digested, as your liver is not functioning properly and not producing enough bile and all. So what happens to this partially digested food is that it will be eaten away by certain bacteria already present in our tummy. Okay, so this bacteria will excrete ammonia as a waste product after eating this partially digested food in our tummy, and the portal vein of course will pick up all this ammonia and push it to the liver. But unfortunately, since the liver is not functioning, it will try to bypass. Because of the high tension, the body will automatically find a bypass route by bypassing the liver. So what happens is this ammonia, which is being produced by the bacteria by eating away the undigested food, will be taken directly to the brain, because the liver is not functioning and the portal vein got bypassed. So once the ammonia level increases to beyond the threshold, there's a blood-brain barrier in the brain to protect the brain. However, when it breaks that blood-brain barrier, it can reach the brain. The ammonia can cause a lot of chemical imbalances, and psychological disorder can happen. Okay, it can start from mild confusion to a very aggressive behavior to a unresponsive deep coma, and this condition is called hepatic encephalopathy. All right, so now if you look at the third one, to usually reduce the fluid retention in your body to avoid ascites or edema, doctors tend to prescribe lots of diuretics. Use of any uncontrolled diuretics may cause a life-threatening case called HRS, hepatorenal syndrome, wherein the kidney will rapidly fail and fatality will happen in few days' time. Right? So we need to make sure we avoid this HRS situation, which can be due to one of the reason is uncontrolled diuretic usage without properly monitoring your BP, which will cause the kidney to balance it, and then there are lots of other complicated function or activities can happen and eventually cause the renal failure. Okay, so these are the primarily three most critical symptoms leads to death. Right? Now, if you look at one of the root cause of all this above complication is none other than the portal hypertension. Apparently, we need to focus on reducing the hypertension, the portal hypertension. If you have noticed, after having a very heavy lunch, you might feel sleepy, right? The reason behind that is the blood flow to your brain will reduce, as most of the blood flow will be focused to your tummy area to aid digestion and absorption of digested food after having a heavy lunch. So essentially what happens is when you eat lots of food, the blood flow to your portal vein will be high, and already blocked filter liver is there, so more blood flow in the portal vein will leads to more hypertension. So eating more food is the reason for portal hypertension, which causes all these dangerous symptoms in cirrhosis case. So the symptom is the funda is to reduce the intake of food so that you can reduce the portal hypertension. Now, I'll give you 4 thumb rules, we can call it, rules to manage and certainly extend the patient's lives. Right? The first one is, of course, control the food. Eat small quantities of food. Take low protein food. And low quantities, low protein in multiple tranches. Okay, and take, of course, you can take liver supplements to maintain the required protein and vitamins. So that's number 1. Number 2 is make sure you have enough albumin in your blood. This will help to avoid the leaking of fluid and fluid accumulation. So One way to increase the albumin is to eat 3 to 4 egg whites in different tranches of in around 12 hours time daily. Okay, so and even still after taking 3 to 4 egg white, still if you feel you don't have enough albumin in, don't hesitate to take albumin injection. Go for albumin injection, right? So that's the second one. The third one is BP management. Don't use any uncontrolled diuretics, and always check your BP at home and maintain a 70/110. Any pressure below 70 diastolic should be controlled by stopping the prescribed diuretics temporarily. Okay, any further degradation of BP to 60 or below, it is very, very dangerous, and you immediately need to boost up it by probably drinking a little bit water with a pinch of salt in that. This will revive your BP for sure. All right, so that's the one. You need to manage your BP. So keep a good BP machine in your home, and regularly, hourly, or whatever frequency, you check and maintain the BP. That's the number 3. Now if you look at number 4th, manage the hepatoencephalopathy. If the patient ate more food or more protein rich food, this can trigger in more ammonia in your tummy and in blood, and this can start causing mild confusion. Start with mild confusion. A confusion, for example, if you say we ask the patient to go and switch on the light, he or she may go there, and by the time when you reach near the switch, you may forget, and may instead of switching on the lights, he or she may switch off the TV. These are kind of mild confusion. And if this happens, what immediately you need to do is you need to flush out your tummy, clean your tummy. You apply enema. By applying enema, you can flush out the left out food and ammonia, everything in your tummy. So clean your tummy, wash out your tummy. That's very, very critical. This you can do it in your home, and you don't need to go to hospital. That once you are done with this, in a couple of hours time, the patient will be back to normal. All right, so that's the 4th one. And the last and 5th one is always strictly follows liver safe medicines. And if you are visiting any local doctor, you need to clearly inform the doctor that patient is liver damaged, and of course you need to be careful on that. That's the 5 important things you need to keep in mind while dealing with and managing the liver cirrhosis. And trust me, this will extend the patient's life for a very, very long time. All right, now before concluding, let me talk about the tip what I promised earlier, that if you are very keen to drink alcohol. See, you just understand an alcohol metabolism will be predominantly in 2 stages. Okay, it involves 2 enzymes, ADH and ALDH. So ADH will convert the alcohol to a very toxic carcinogenic component called acetaldehyde. And then immediately ALDH will convert the acetaldehyde to acetate, a non-poisonous item. But what happens in case if the particular person doesn't have enough ALDH, the second enzyme, then the poisonous toxic acetaldehyde stay in your bloodstream for long, and this can cause damage to the liver. That's essentially what happens in alcoholic cirrhosis, right? So you can improve the ALDH, and you can remove the acetaldehyde immediately. And for that, what you can do, you can probably, while taking alcohol, you can mix it with a soft drink primarily known as Sprite. Okay, essentially this drink has a chemical called taurine, which will help out to remove this poisonous items as early as possible by minimizing your hangover and your toxicity in the liver. All right, that's all, and I hope you enjoyed this video, and thank you for watching my video, and we'll meet again with another informative video. Until then, goodbye. Thank you so much.